Hey, hey, let me see if I can get some mic here. How are y'all? It is Wellness Wednesday, and today we are talking about heart health. I'll give everybody a minute to get on. If you're joining me for the replay, I'm Audrey Christie. I'm a holistic wellness practitioner. I help people heal from the roots up and the inside out. I take sort of a three-pronged approach, body, mind, and spirit. That's part of the holistic nature of it, right? So you have to have three pieces or three keys to make it all come together. Today, we're talking about heart health. Actually, this is the one I was supposed to do last week, and today we're supposed to be talking about yoga. But I'll probably pop on and do yoga on Friday or Monday or something to get caught up, because it is summertime here. So between seeing patients in the clinic and seeing patients, my virtual patients online, I've got a lot to do. So I didn't have time to pop in and do a live for you. But I want to do that now. So we're going to talk about heart health, right? And no, it's not February. It's not Heart Month. And no, I'm not a big fan of the American Heart Association. We're going to talk about not just covering up heart problems and not just treating the symptoms, but actually how to heal them from the root cause. And there's really three things to keep in mind when you're talking about heart health, right? Because nobody wants to have a heart attack. They're big, they're scary. You may have seen your parents have one, or your friends or coworkers, or you may know that guy that was only 40 something and had a heart attack, or that gal that's 41 and had a heart event. And you might be thinking, well, gosh, I'm approaching that age, or I am that age, or I'm over that age where, this could be knocking at my door. Here's the thing, guys. Heart health is important for men and women, and it's not what you think. We're going to take a three-pronged approach to that, right? So nutrition, stress reduction techniques, and supplementation. You got to have all three. Now, this is all fairly simple to do, but that doesn't necessarily make it easy. So nutrition-wise, so you have to remember, first of all, that when you're talking about heart health, all of these things work best when they work together. So any protocol I give you, especially like this, actually, you know what? This is a great place for a disclaimer. So I am not your doctor, and I don't play one on the internet. If you work with me, I'll give you specific advice one-on-one on how to work through whatever your health problem is, whatever your wellness issue is. However, in this format, this is very broad and general advice. And so it may not be specific to your case. So keep that in mind. Ultimately, you are responsible for your health and wellness, no matter who you see, whether it's me or anyone else. So with that disclaimer, let's move on. Hi, Maria. How are you? Thanks for joining. So we're talking about heart health, right? Nobody wants to have the phone call for their spouse or for themselves where, like you have the chest pain and you're being taken in for a heart attack. Nobody wants to be on the table for a heart catheterization, or God forbid, a bypass for that matter. So I want to talk a little bit about those types of procedures, right? Because people think they have those procedures and they have cured the problem. What you've done, especially with a heart catheterization or a bypass, and just look at the word bypass, you haven't fixed the problem, you've bypassed it. Literally, it's like taking a detour on the highway. You have rearranged the connections for the vessels in a bypass in order to shunt the blood flow around a different route. A cardiac stent or a catheterization is just taking that vein and restructuring, I guess you can't say it that way, but making it so it's condensed down, you're cleaning it out and making it patent again, but you're not fixing the reason why it became constricted in the first place. So again, when I talk about these protocols, nutrition, stress reduction techniques, and supplements that go together into creating heart health, you want to remember that it works better when they're all combined, right? So it takes a group effort, all three prongs. So first, let's talk about nutrition. If you have a family history of heart disease, I'm going to tell you something that's going to sound really counterintuitive to what you've learned, but you need to be eating healthy fats, and quite a bit of it. You need to be eating a very low sugar, very low glycemic index, moderate protein, high in good fats diet that looks a lot like the Mediterranean diet. So it's going to be full of lots of seafood and lots of vegetables with lycopene, like tomatoes, lots of leafy green vegetables, lots of meats that are healthy, seafood, I think I said seafood already, but chicken and beef and all those things that are raised humanely and that are very, very healthy. So you want to take the framework of low carbohydrate, moderate protein, high in fat, and apply it to, or combine it with, a Mediterranean style diet. That's going to work best for prevention for your heart health. So that covers the nutrition aspect of it, right? The second aspect is supplementation. So for heart health, basic heart health, if you're not having any problems, so this is preventative in nature, right? So we're not fixing heart problems. You're looking at omega-3s, 3,000 to 5,000 milligrams a day. You're looking at keeping your vitamin D levels maintained. You're looking at a good probiotic because we're discovering the connections between your heart health and your gut. You're looking at keeping your electrolytes healthy. So electrolytes are magnesium, potassium, and sodium. So if you're not getting enough of those in your diet, a lot of us aren't, then you want to supplement with those as well. And then again, this is for prevention, not for cure, right? So if you're not having any symptoms, if your lab work is really, really normal, this is the direction that you want to go. And then the third piece of that is stress reduction therapy. So what does that look like? Well, that could be getting a massage. That could be having a crystal healing therapy session. That could be something you do at home. So it could be meditation. It could be grounding. And so what I mean by grounding is actually going outside barefoot, physically on the earth, and shedding negative electrons, which build up and cause inflammation in your body, which affect your heart. So that's another really, really important part of heart health or prevention when it comes to heart attacks and heart disease and cardiac events. So again, if you just go out and do the stress reduction techniques, you're doing good, but you're not doing best, right? If you just go out and do the nutrition, but you're still in a really high stress environment, you're not doing anything to mitigate that, and you're not taking the supplements, then chances are your body's still not getting the nutrients it needs to have the best cardiovascular health. And then the third, of course, if you're eating if you're just taking the supplements and you're eating like garbage and you're not doing the stress reduction techniques, then, that's another aspect where it's not all going to work together properly. Another stress reduction technique is moving your body. So that could be like yoga, it could be walking, running. The key there is something that you'll do, not necessarily what it is. So people think, oh, in order to have a healthy heart, I have to go out and jog 5 miles a day. No. If you hate jogging and you only do it once a month, then that's not what you need to do. If you love jogging, then that's totally what you need to do, right? So there are really 6 total factors that make or break your heart health. Healthy diet, right? Like I said, low carb, moderate protein, high and healthy fats. And again, if you have a family history of heart disease and you want that to lean towards Mediterranean style diet. The second thing that is a make or break heart health is your, they call it BMI, but really it's less about your BMI. That's sort of trying to cram everybody into one box, and more about your body fat percentage and keeping your body fat percentage in a healthy range, no matter what your BMI is. The third thing is getting at least 2 to 3 hours of movement a week, right? So sitting less, walking, moving around more. It doesn't have to be, oh, we have a guest. It doesn't have to be a dedicated workout, right? It just has to be movement. The fourth thing is not watching television or watching television for 7 hours or fewer each week. So, and that just goes to sitting is the new smoking, right? So you don't want to be sitting in front of the TV. If you're watching those 7 hours of TV on the bike or walking, if you're walking on a treadmill, then that's okay too. The fifth thing that makes or breaks your heart is not smoking, right? So smoking, sitting, those are 2 really, really big trouble spots for heart health. And then the sixth thing is limiting alcohol intake to 1 drink per less per day. And no, you can't save up all 7 drinks and have them on Saturday. So it doesn't work that way. But if you do have questions, please do drop them in the comments below. One of the questions I get a lot are, what labs do I need to know? Because people, a lot of traditional allopathic physicians will tell you that cholesterol is the end all be all when it comes to predicting cardiac risk, and it's really, really not. So if you suspect that you might be in a high risk category for cardiac events, or if you have a family history of cardiac events and you're maybe approaching the age that mom or dad or grandma, grandpa, aunt, uncle had some sort of cardiac event, then let me know and I'll give you a list of labs to ask your doctor to run so that we can actually get a reliable and good picture of what, what your cardiac health, what your cardiac risk actually looks like. So that's about 10 minutes worth of heart health. The full episode will be released tomorrow, as well as the full yoga episode. And again, I'll come back on Friday and catch up on, we're going to talk about yoga for weight loss on Friday, or how yoga plays into weight loss. So I hope you will join me for that. Again, I'm Audrey Christie. Feel free to put any comments or questions below. Hope y'all have a wonderful rest of your Wednesday. Namaste.